So I wanted to show how receiving information, augmenting that information with appropriate technologies can change dramatically the patient quality of care and improve the metrics for long-term care facilities and prevent the readmissions and have a documentable increase in quality. What I'm suggesting is that the Castleton Group can provide a total package here to address really every need is required to change this whole picture of enabling virtually total reduction of readmissions through leveraging complementary sets of technologies, including telehealth, including advanced technologies for analyzing the medications, being able to have non-invasive instruments to monitor the patient remotely, be able to invoke sessions with the appropriate specialists for patients in the skilled nursing facilities or from home, and to be able to have virtual care in every aspect that may be needed to improve the quality of care and prevent readmissions to hospitals and accelerate the recovery of patients. And what I'm suggesting in this couple of slides is simply that two technologies in particular could be immensely helpful in realizing this vision. First, let me describe the flow here. As the patient is discharged from the hospital, the EHR systems can output a continuity of care document that has the medications, has face sheet, basically all of the core information that's needed to have the continuity of care in a transitions of care model. And so we can invoke at that point, in fact, a full patient history with instant medical history, the IMH, which produces a very thorough history. It's an expert system to do that. It's the only system of this type and endorsed by the Mayo Clinic. We can leverage the MHC technology that has all of the components necessary to monitor the patient and view the patient and to engage with the appropriate healthcare professionals as needed, with including remote sensors. And then since a huge proportion of the readmissions are caused by the medications as well as many other problems that the patient's experiencing, the average 65-year-old just at home being on 8 to 10 meds, we can use a technology called Med Risk Maps that can accelerate and perform the medication therapy management. Kaiser Permanente has shown they've been able to take an MTM session from about 90 minutes or more to as little as 13 minutes. Far more scientifically, far more thoroughly, far better than they can do with any other technology. By the way, the Med Risk Maps also produce the CMS reports that are required by CMS, and CMS pays big bucks, as you'll see, to conduct these MTM sessions. So I thought I would address in small part how the revenue actually would work to the Castleton Group and to our respective partners. We could offer to the hospitals this service for which they would pay some money to try to keep the patient out of the hospital, even if we can prevent those readmissions just for one day. That's a significant sum. And incidentally, Kaiser Permanente with Surveyor Health MedRisk technology, MedRisk Maps, has been able to prove that they can, with that technology alone, be able to prevent readmissions 44% and improve quality 15x and improve productivity of the staff 3x, 300%. And so again, we could offer as a total package invoking the instant medical history, and we can supply this service in the home to skilled nursing facilities or any other appropriate areas for the transitions of care. Again, leveraging MHC for all the virtual visits and other complementary technologies, including remote sensors in the home. And we have some very powerful, unique technologies in that domain. We would receive for this package some dollars from the skilled nursing facilities to improve the patient experience, the patient's care, the quality of care, and be able to have for them the entire patient history that's done with this expert system, to be able to conduct the MTM sessions, produce the reports with virtually all of these newly admitted and existing patients in the skilled nursing facilities or from home, preventing virtually all readmissions back to the hospital due to medications, and with the MHC technology be able to address much of the remainder of the problem issues there. So there's a cash flow from CMS that's substantial. It's about $150 per patient, and there are multiple sessions, follow-on sessions per year. And virtually all of these patients will qualify under medication therapy management. This technology is, again, the only technology endorsed by the Mayo Clinic, and there's some articles that we can present to you about that. Thanks.